Hello. Okay, we'll learn about approach to patient of shock. So, say for example, there is a patient who comes with low systolic BP. Say for example, systolic BP is 90. Presents with SBP 90. So, what are the things we have to check immediately? We have to check if the patients have cold clammy extremities or warm extremities with a bounding pulse. So, say for example, the patient is having cold clammy extremities with an SBP of 90 and DBP maybe of 50 or 40. This means that the patient is having low cardiac output. Now, a patient with low cardiac output may have both an empty heart or a heart which is full heart. So how do you know whether the heart is empty or heart is full? Because the treatment will depend on this. So we'll do the general physical examination. In general physical examination, we'll look for GBP, we'll look for lung auscultation, and we'll look for orthostasis. That is difference of BP in supine and in sitting position. So, say for example, JBP is, the pulse is high, JBP is high, we can see it while the patient is on sitting position. Normally we cannot see JBP when the patient is in sitting position, and when we auscultate the lung we see crackles. Okay, if these two we can find, we can think of the heart is full, that is there is cardiogenic shock. So now what we'll do, we'll evaluate the patient for MI, because this is the most common cause of cardiogenic shock. So we'll do an ECG and evaluate the patient for myocardium. We'll do an ECG and we'll do drop I. What we can also do is we can consider an echo, and treatment we can give ionotropes like dopamine, and we can do afterload reduction like we can give furosemide, or we can give the IV nitroglycerin. Now let's say that our patient is having decreased GBP. Now we can see the GBP, the pulse we can see, and there is orthostasis. That is, there is significant difference between supine and sitting blood pressure. Okay, so we are here now. This means the heart is empty. So this is a case of hypovolemic shock. It may be due to blood loss, or maybe also due to diarrhea. The treatment is with intravenous fluid. It should improve with intravenous fluid, but if there is no improvement even with intravenous fluid, then we have to reconsider our diagnosis. We should look for other clues like adrenal crisis, right heart syndrome, or pericardial disease like pericardial tamponade. And we should also consider an echo, and we also have to do invasive vascular monitoring. Okay, now the third one. What if the patient is having warm extremities and bounding pulses? This means that the patient has high cardiac output. So a patient with high cardiac output and in shock should be in either septic shock or in liver failure. So the treatment should be antibiotics or aggressive resuscitation in this case. Okay, that is all. Thank you very much for watching.